Immune-related adverse events are becoming more common in patients receiving immunotherapy.
But you can't treat something if it hasn't been identified.
Welcome back to Cancer Buzz, the show that brings you the latest in oncology news. I'm your host, Summer Johnson. Today, we're talking about how cancer care providers can better identify immune-related adverse events caused by immunotherapy.
Understanding the best practices for identification is going to be the best way we can start to implement better treatments for these immune-related adverse events.
Today, we're joined by Ami Gordon, clinical research PhD candidate at the Icahn School of Medicine at Mount Sinai in New York. Gordon worked with ACCC on its annual Immuno-Oncology Census survey that aims to understand trends and educational needs of the oncology community. Ami, thank you for being here today. Let's get right into it. What led to this bigger focus on immune-related adverse events?
So this survey has been ongoing since 2020. I joined this research group in 2021 for the first survey with them. The idea was that there's a steering committee of scientists and physicians who guide the survey every year. And every year we change the survey to really accurately reflect the challenges that are current to immunotherapy. So every year we have edited it and added on. This year specifically, we put on the focus on adverse events. My personal research focus is on the biomarkers that drive immunotherapy. And so there was a section on the survey for that. But we added on the adverse event information because this is the real challenge in the implementation of immunotherapy now in the clinic. We added on questions that were both about how immune-related adverse events are reported, as well as the training that goes along with that. And the big focus, particularly in this abstract, is that there are currently no real guidelines that cover immune-related adverse events. Immune-related adverse events can be very broad. They can cover many different disease systems. So they can be dermatological, they can be gastrointestinal, they can be neurological. We can see them in many different places. And so in oncology care, the challenge is handling and seeing and identifying these immune-related adverse events and reporting them appropriately to be dealt with.
What's the most important thing for providers to take away from this research?
I think that this is a hot topic at the moment, the immune-related adverse events. And I think that it's not as exciting to talk about identifying the adverse events as much as it is exciting to figure out how to treat them and handle them. But you can't treat something if it hasn't been identified. And really trying to empower physicians to get a better understanding of how to holistically care for their patients and catch an adverse event, if you can catch it at the point where it's significantly more treatable, is a really powerful tool. We saw that most institutions do provide some sort of training for these adverse events, but we still saw a very broad method of reporting it. And we think that creating some sort of best practices is going to be most helpful for physicians because it's something that they can institute right now.
What has been the biggest challenge developing these best practices?
ASCO is a broad conference and it includes many different tumor types. Cancer is generally split up into these histologically defined subtypes: breast cancer, lung cancer, gynecologic cancers, whereas immunotherapy has been one of the therapies that's permeated most of these tumor types. And so it's truly applicable to almost every treating physician at the moment. And the challenge becomes looking for all these immune-related adverse events where it's such a broad group of physicians and trainees and scientists as opposed to some specific tumor type. So the immune-related adverse events specifically is a really broad audience conversation. And we need to see in these different settings how we can best identify these immune-related adverse events for physicians, for patients, in order to get better outcomes. Immunotherapy is believed to have more tolerable side effects, but as it is becoming more prevalent in the clinic, more immune-related adverse events are being identified as immune-related adverse events, and we are seeing novel ways to treat these events. But again, the key point is identifying them. And so understanding the best practices for identification is going to be the best way we can start to implement better treatments for these immune-related adverse events.
Thank you, Bat-Ami. The poster is available to view online. You can check it out using the link in this episode's show notes. Thank you for listening. Stay tuned for more on the latest research and best practices from the Cancer Buzz team. This is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.